Good morning and thank you very much for joining us. I am Yori Folani with my colleague Asukwo James.
Good morning to us.
Indeed. So, well, the battle continues. COVID-19, we must do everything possible to stem the flow of COVID-19. Now, one of the main aspects of that, we've been learning about all of this. Yes, you must wash your hands, incessantly almost. Let's just use that word. Incessant washing of hands can't hurt. But the community transmission is quite important because we're hearing that we're getting a higher rate of that. Not so, isn't that what you're getting
Exactly.
to?
Exactly. And that is where the problem lies now, because the virus has gone away from being imported to being in the communities now. People who imported it have now moved it to people who didn't even bother, who didn't think of traveling.
Who have not traveled.
Yes.
And that is beginning
and so they also mixed with people, maybe one or two or a couple of them actually went to the market, or even maybe their housemaid who they actually came in contact with, actually went to the market, and then that is where the problem lies now.
Also, compounding that problem is the thought, maybe we should call it a hypothesis for now, that people are not being sincere. Some people probably came in, were asymptomatic, and have not declared their status, because there are those that have put a stigma on this by themselves and so don't want to come out with the matter. And that's a problem as well. In fact, the whole matter of testing is also an issue. How well we are doing by way of testing, how efficient is our testing? Because there are those who are also opining that the numbers are what they are, high to us, but relatively speaking, not as high. But they are what they are simply because that's the limit of our testing, that if we were able to really spread out and test properly, there are those that are guessing, and I guess that's the word to use, that are guessing that the numbers would be higher than this. And so that's part of the challenge as well.
Exactly. Right now, I think it was yesterday or 2 days ago, the PTF, in their meeting, they said they are thinking of going higher from 1,005 per day to 2,000.
Yeah. Yeah.
And it means if we can push up the number of testing a little bit,
yeah,
we'll be able to get to everybody, particularly those who've been able to, contact trace. Because if we don't increase the number of our testing capabilities, then there will be a huge challenge.
Yes, because we have to be sure. Even
though who are those that are infected, and who are those who in quotes, possibly might be infected, but they don't know.
Let's come back and talk about this a bit more. But in the meantime, marketplaces, with the situation we have, distancing, do your social distancing, but we still have to go to the market, and everybody knows how our market is. What is the extent to which we shall be able to do social distancing in those kind of situations? Abimbola Agbebi, she went to the markets to find out, and we have a package from her.
National Food Market is arguably one of the largest and busiest in Lagos, Nigeria's commercial nerve center, now in the face of a pandemic that is presently ravaging the whole world, and the need to contain its aggressive spike and bring down the numbers of new infections. Perhaps the biggest headache facing the city is how to ensure that social distancing is maintained in places like this. A look at the commodity market system practiced in this part of the world. There are fears that enforcing social distancing might be a Herculean task.
Look at the crowd now. Here is locked. Go up, go down that way, and see the crowd. So tell me, if only one person comes out with coronavirus in this crowd, don't you know that 20% of the people will contact it, and every day we start increasing. We still having numbers of people infected with coronavirus.
Days into the lockdown, the market is still as active as it was before the restriction of movement. Traders sitting close to one another, apparently in a competition to display their wares at vantage positions. The market authority says they are helpless in enforcing the directive every day.
In sincerity, I don't think it will be that easy for anybody to ensure social distancing in an informal market like we have here. My 12th international food market, perishable market, is the largest in Lagos. We supply over 300 smaller markets in Lagos. So it is a critical market and it's very huge. We are trying our best to make sure we observe all precautionary measures.
Health personnel moved around, sensitizing the traders on the dangers in keeping close contact with people. They showed us leaflets containing vital information to help the traders understand all about the pandemic. They taught us hand washing and the dangers of keeping close contacts.
When we got to this market, the market looked as if we are doing the same thing as usual. We are not really observing it. Of course, inside the market, of course, it's a little bit better off. But outside the market, we are not so happy.
Another twist to the story is the millions of naira reportedly lost by traders in perishable food items attributed to the lockdown. It is hoped that Nigerians will observe all precautionary measures to stop the spread of the virus. Abimbola Agbebi, TVC News, Lagos.
Indeed, and thanks for that report, Abimbola Agbebi. Actually, she's on the line now, and I'm in the studio with Asukwa James.
Yeah, morning, Bimbo. Bimbo, good morning.
It looks like we're having a little bit of a challenge with the lines, but we'll work it out. But just looking at her report there, she was making the point. It's going to be like that, I guess, in most markets of the country, and indeed when you go to third world markets. These are the kind of community markets, and here we are worrying about community transmission. Yes, that's, you know, communities are more than markets, but that's where we have the closest contact, and that's where our food comes from. We don't do supermarkets. We don't do supermarkets like that. It doesn't mean that there aren't some malls around. And so this is part of the challenge into the mix.
That is the biggest challenge that we have in this part of the world, you know, and I'm very sure it's also going to be like this in India and some other countries, you know. And if...
And I think Bimbo is on.
Okay, Bimbo. Hello, Bimbo. Hello, Bimbo. Bimbo.
Abimbola, can you, Bimbo? Well, please continue.
You know, so for us to, for people to, you know, take the social distancing or the physical distancing.
Which must be, it's recommended at what, 2 meters?
2 meters, you know, it will be very, very difficult, you know. So I think what we'll have to start doing now is to see if we can push the issue of social distancing, as in sensitizing people on what COVID is all about and the likely impact on our lives, you know, in the languages that people will understand.
But you see, if we're going to continue to go to those kind of markets, I don't know how social distancing is going to work. Take one market that I saw, and it's not this kind of a community market. It's the Ikeja City Mall. And now they got people to queue, and they had people to be 2 meters apart in the queue. And then when you got into the place,
another market.
You can
it
just
becomes
spread
another
out.
market.
But then when you came to when it was time to pay, again they'd got these tapes on the floor.
Okay.
They were 2 meters apart. Now that could be done because it's an air-conditioned, you know, tiled market and that kind of a thing. But how do you do anything remotely similar to that in these kind of markets?
It's going to be very
so
difficult.
It's that what you were saying, that
difficult.
people just have to know that we have a dangerous enemy in our midst, the more dangerous because it is invisible. But I think it's because people haven't grabbed hold of that idea yet, that maybe face masks are totally indispensable once you go into these kind of environments, I would guess. So, yes, I see the campaign about face masks and all of that, but in the kind of market that Abimbola Bini is in, you would have wanted everybody there to be wearing a face mask. So that will give you the sense that they are sensitized.
Yeah.
But too many people think it's much ado about nothing.
I think what just like you said, first they have to sensitize people on the dangers and what COVID is about. In the language they understand. Because if I'm going to a market...
But everybody in that... I'm going to say something. Everybody in that market that we saw has heard of COVID-19.
As what?
As an infectious disease. They know, but they have this notion that it's a big man's problem.
If
that
you say...
I don't get blamed. I don't get money to buy any ticket to anywhere. This is the way they're looking at it. I've never come out here. What it concern me, concern me, is the erroneous way in a lot of our ordinary folk are thinking about it.
If you say it doesn't concern me, and they know that it's an infectious disease, you can also say, okay, that big man that you want to come to the market will not come because the person is sick.
Okay.
Those are some of the things you need to break down for them to understand.
Okay, it's a third world issue. It's not just us. And even here, you go up north, that's the way the markets are. You come down south, that's the way it is. Go to the east, everywhere.
Everywhere. So it's going to be a very big challenge.
And we've already had the challenge of not everybody in their dwellings are able to, keep the proper distance and do the needful. Not when you have these tenements where I understand that in something you might have up to maybe 20 people in a particular building made up of how many families, that kind of a thing. So it's like we're trying to bring focus on... Because the World Health Organization has said that countries are going to have to work out their own modalities to really hammer this particular point, that we must break the transmission of this disease. And person-to-person transmission now, people that never went near any airport in their lives, they are now vulnerable.
They are being infected by the virus. And that is where everybody has to see how they can break that circle. If you have to stay at home, stay at home. If you want to go out, make sure it is...
Nobody wants to stay at home. That's another part of the problem.
If you are going out, make sure it's only for essentials.
There are those, as you know, who, and that brings us to another aspect of this whole conversation. There are those who were able to, quote-unquote, do the right thing and stock up with the required amount of rice for 2-3 months, everything, soap, milk, all those things. But that is probably going to be take 1% and divide it up into maybe 20 places again. Those are the people that were able to do that. Most people are going to need to be refueling, so to speak, on a regular basis. And therein lies the danger when people come out to do this refueling. God forbid, they might actually be transmitting or catching the disease. So it's a problem.
So if you are going out to refuel, you can either put your gloves and put the face mask.
Yes.
At least that is like a protective gear for you, for going out to the market to get whatever you want to get. So that you don't just go and say, okay, I'm free. I was home for 3 days. The 4th day, I'm a free person. I'm coronavirus free. Then you start walking. So people must also see that, okay, just like the WHO is saying, you have to detect, you have to test, you have to also isolate. So people must have that at the back of their mind that if I don't have this thing, I might fall into isolation. And our health infrastructure is overstretched. So that is where sensitization is key. When once it comes to this
because what all the
is really, really key at this period.
What all the experts are saying is that the numbers we have now, and we are getting, spats of good news. There will be announcements that people are being discharged,
yes,
but the numbers are rising. I understand.
And they are not testing. They are not testing like like in the UK and
Yeah,
the US, that
yeah,
they are
yeah,
just doing
yeah,
general
yeah,
tests
yeah,
for
yeah.
everybody. Now, if you look at it, if in Lagos, I know they went to 1004, I said they did testing. They are doing door-to-door for at least areas that we feel like Ethiopia has the highest number of people that are infected. So they are trying to, do the door-to-door in that particular local area, that is the local government. So if we do the testing door-to-door in 1004 VI, do in Lekki, do in Ikoyi, Banana Island, all those areas.
And you're talking just about Lagos.
That's
You
just
because
one part of Lagos.
Just one part.
So
Because
if
when
we are
you
able
finish
to
now,
do that,
can you move
we
over to
can
Port
now
Harcourt
move to,
and let me know what's going on there? Move over to Enugu.
But that has to be done fast.
Well,
It has to be done fast so that people, because already the lockdown, people are already tired.
yeah.
People are tired. So we need to be fast with the testing and make sure that the results
so
are
that we
out.
can isolate whoever needs to be isolated.
Immediately.
Yeah.
So even in Lagos, by the time they finish with Etiosa, they have to come to Magodo. They have to go to Sule, where we have the high and mighty, all those areas that we know. So because those are the people that are always traveling and coming back, and they are on isolation right now. So we have to do that as fast as possible before we now start telling Port Harcourt, people in Port Harcourt to do, people in FCT and Ogun State too. Because even the last one in Ogun State was in Ibafo. And Ibafo to Lagos is just a stone throw. So things like that.
Now, as all the professionals,
the testing has to be fast.
Let's see. I think we might have got someone on the phone now. Hello, Honorable Adeogun. Good morning. We're trying, as you know, the focus now is on disrupting community transmission. But here we have our markets. They are what they are. What are your thoughts? Because what are your thoughts on people's attitude to social distancing?
Well, I think the basic problem is that not many people understand what physical distancing entails, especially the market women and people who are in markets, who patronize markets. What we experience in my state, and I think it's the same in most other places, that there's a resistance to an attempt to actually get them to maintain physical distancing. I know in one of the markets in Akure a few days ago, there was a near crisis because of the resistance by the market traders. But they've been moved to a bigger place, a public place, where they can at least maintain some measure of distancing. I think is a problem, nationwide.
As it happens, your committee in the National Assembly, in the House of Representatives, is security and intelligence, really. There's a security aspect to this, is there not?
Yes, the security aspect, not just in terms of the market or social distancing, but in terms of the problem within the larger society, because of we don't have an existing social security net to cater for those who are unable to provide for themselves at this period. So, of course, the natural thing is that there'll be resistance, and there are a lot of people who feel like they shouldn't be kept away from any livelihood one way or the other. People are hungry, and they have to look for ways to eat.
Indeed. So we shall be coming to be talking about food security is part of security. The financial security is part of security. And in that context, as you know, a policy document was was published yesterday by Ashwaji Bola Ahmed Tinubu. So we shall be looking into some aspects of that, policy recommendations and that kind of a thing. But the point was made in that document that, look, even if you don't have money, if a family without money still needs to be able to feed, and that's the security that we're talking about. That is what will bring them through the market, and this is where it's one of the biggest dangers, because all you just need is to be infected. I don't think you need more than a second to be infected, and then you go home and you don't even know it yet, and that's the heavy duty part of all of this. Honorable, do you have any thoughts on what can we do? For instance, in your area, you said, I think I heard earlier, even though you couldn't hear me, you said that in your area, which I think is I believe is Ondo State, that it's not too impressive the way they are going about that concept of social distancing. Was I right? Is that what I heard?
I didn't quite get you.
You were saying that you are not unduly impressed with the attitude of your community in Ondo to social distancing.
Not just my community. I think it's the general attitude of Nigerians,
Yeah,
especially people in the
I
rural
know.
areas.
But
The
because you are
perception is
there,
that
because you are
coronavirus is
there,
for
it's like
the
I was
elite, it's
trying
for
to
the
get a
rich.
report of
And
you
so people
being on
just
the
tend to
ground there.
ignore advice on physical distancing. So
Okay.
I think that's where we need to do a lot of education of people so they know that this is an ailment that anybody can contract.
Yes. Well, in terms of what you've just said, that is becoming more and more enlightened that this is something that could affect anybody. Again, let me go back to the whole security aspect of it again, since that's one of your specializations. The whole matter of testing, how efficient are we with our testing? That's another aspect to it. And there are allegations that some people are opting, and I don't really have the proof now, but these things will start, and there's no smoke without fire, that some people might actually be opting for private treatment of, the virus infection, which must be an absolute no-no. If there's any reason you don't want to go to the government, state-of-the-art facilities because of any stigma that you might perceive, it is alleged that some people are actually, opting for private treatment. And of course, as soon as government knows, they would close down such a place. But have you heard of this particular notion?
Yes, I've heard about the issue of people opting for private treatment. Even before yesterday's press briefing by the presidential committee, I'd heard from a friend whose relation was ill and was hospitalized somewhere in a private hospital in Ikoyi, who explained that when they got there, they saw signs that there was some people were being kept that could have been COVID-19 patients. But the truth is, that is actually the problem of the elite, those who feel too big to government facilities. So they're endangering people, and then the medical facilities, the operators of those medical facilities who are allowing access to such patients too, should be held liable. But on the other side too, I read a policy document by Lagos State government yesterday, and I think the national coordinator of the COVID-19 task force too did mention that efforts are being made to actually license a number of private facilities to attend to those people who think they have the means to obtain private treatment.
Honorable, I want to thank you very much for joining us on the program via Skype today. Thank you very much, and I'm sure you don't need me to say that you do all that you can in your locale to keep the people enlightened as to the danger that confronts us and that we must overcome. Thank you very much for coming on.
Good to be with you.
All right.
You're welcome.
So, here we are. If we can get Abimbola Agbeni on the line, we will speak with her otherwise, but her report was pretty lucid, and we did get the point she was making. And I don't imagine very much has changed since she made the report, and it was put together. And this morning, we would like for there to have been something totally different, but it's not going to happen. We're going to open the phones as well, because it's been it's been a bit of some length that our viewers haven't been able to call in. So we shall be taking your calls in today as we look at this particular aspect, efforts to disrupt, the transmission, the community transmission of the disease. It has landed, it is with us, and now experts are saying that it's not a matter of people coming in with it anymore, even as that may be happening. But there are people in here, and if there's community transmission, it means that somehow they slipped through the net. So that's why they're able to, in this connection, our people are Nigerians in China. There was a time when there was a brouhaha. They complained that they were being maltreated. All sorts of authorities in Nigeria.
Which they denied.
Yes, indeed. And
I think the matter has been sorted out.
I saw Gbajabia Mila, Speaker Gbajabia Mila,
even
saying
the Minister for Foreign Affairs,
yes,
also sorted.
But it was in the effort of the Chinese, as one of the people explained over there to us, one of Nigerians, in the effort to just make sure that this kind of a thing doesn't happen, that you don't have people who should be isolated as it were, going in and potentially infecting people, into society.
No, Uncle Yori, let me put this. I don't know, because as this thing keeps going and going, there's every possibility from what experts are saying, that even after the people even testing positive, and we are even flattened by our curves, that there's a possibility that it might still come back, one way or the other. So it means if we are able to deal with it and make sure that we don't have anybody that is infected in any way, and if we can do it now and do it well, there's a possibility that we won't have the virus. But there's also the experts are also saying that even in trying to lock down people in their homes, there's every tendency that there might be another virus which is even more than coronavirus, which is the hunger virus, And
I knew that's where you were going to come.
So and that is where the Ashwaju economic
the proposals
comes in.
The paper.
So if we are able to deal with that now, and we are also tackling the virus itself together in any way possible, we'll be able to, go out of this mess.
Okay, let's take a break now. And then, as I said, when we come back, we'll be able to open the phones and hear from you at home. Stay with us, please. Okay, welcome back. And as I expect the phones are jangling off the hook, indeed, in this half of the program, we shall be taking your calls. We haven't done that for a couple of days because of, topics on ground and where they were going. But things are different today, so we do want to hear from you. And the focus, please, is going to be social distancing, appropriate social distancing, and the challenges that this presents to us. As Abimbola Agbebi's report that we started the program with shows, everybody can recognize the situation in our local markets, and this is a real big danger. So we want to hear from you what the situation is. Now, what we were saying, apart from that, this whole matter about, I don't know if we can call them outrightly illegal operations of hospitals and doctors treating people privately. You were saying feeling too big to go to the public centers where they have the utmost, the ultimate in care. Well, maybe I have my doubts about it being a matter of being too big. I think it's just because perhaps they feel stigmatized, especially if you are not one of the masses. People might jeer that, you had the money to go and contract it, that kind of a thing. Because people here are saying, no doubt erroneously, that it doesn't concern me. I don't even know where any airport is, not to talk of taking a plane and going to any foreign land and coming back with anything. It is those people that went. They are the people that have the problem. So from that erroneous, presentation, it's possible, conjecture, that a lot of those people that are opting for private treatment don't want this whole matter about people thinking, oh, you did yourself. Now you get money where you could get them. You know how it is.
I think let's put it this way: self-help will not help us. If you have COVID-19, it is not a death sentence. We have seen people who have gone there to that isolation
and
center.
And they are
coming out. And they are
almost every day.
They are even giving testimonies, of how they were treated, how they were taken care of, and the series of, things that happened there. So people should not think that when they take you to Yaba or to Onikon or to wherever, it is for them to just abandon you there. No.
Nobody, they know that's not the case.
No.
They know.
In fact, that is where they will take good care of you, because they know that you are a national risk. Because once you go out, you infect others. You infect your family, and then your family will infect other people. So you are a national risk. So any private, I would suggest that any private hospital that is illegally taking care of those, that is knowing that this person is actually infected by COVID, and the person or the hospital or the facility is taking care and treating anybody that is infected with COVID, that facility should be closed down, and then those who are the owners should be prosecuted. It is only when the Lagos State, because already the NCDC and the federal government, they are trying to see how they can co-opt private hospitals into, taking care of and treating COVID. And that is when they are certified by the federal government and NCDC. If you are not, please let the state government, who have been doing a yeoman's job, let them do it. Because they have the facility, they have the manpower. And that is why we are all praying for our health workers. Because it is not just somebody, oh, I have headache, and then you go, meanwhile you have COVID. Then you now put the person there. Tomorrow, the person starts having pneumonia, and then you now bring ventilator. It is not about that. It is more than that. Because you must have the PPE, you must wear PPE. There are so many things that are involved. If the Commissioner for Health should call in to tell you the process that are involved, you won't even pray to have the COVID itself. So our private hospitals should not be in a hurry to say, okay, it is one big man that came from US or one big man that came from UK that is infected, so I have to treat the person, or he's my regular customer and he settles me, in quotes. It is not about that. If you detect that person has COVID, call the regular numbers, let them come and pick the person, take the person to the isolation center. It is not a death, it is not what is it called? It is not a morgue. It is from there they will take care of you, they will attend to you, test you, isolate you, and make sure that you get the proper care. Because we can't afford to allow people to take laws into their hands, because this is like doing an illegal business here. It's just like the people that actually allowed that they didn't tell us the travel history of one of their relative, the person that died in Louth. That family too has to be prosecuted. Even if they put them under isolation for 14 days, let them come back and face the law.
Indeed.
By the time people will understand that this thing is serious business, I think that it will sink in.
In addition to what you're saying, we were talking about people are still busy digesting the Asiwaju policy recommendation document, because it does, it is a far-reaching, a very wide, it touches on just about all the aspects of our lives. Even though the document doesn't, and the document does say that it's not attempting to be exhaustive of all possibilities, but that these are, thoughts that, possibly could be considered. Now, the whole matter about how to get the palliative, one idea that would have jumped out to a lot of people that might not have been as understanding of all the highfalutin technical financial aspects of it, even though those are crucially important as well, is the whole matter of how to get money, how to get money or food, to people. Look,
it's difficult.
It is. Right, quite frankly, it's not impressive the way that we have seen government going about this whole matter with the raw physical cash business. There are Nigerians who are asking very simple questions.
What happens to BVN?
What, my BVN? In fact, some people are even joking that, look, whoever gave NCDC my phone number should please just give them my bank account number as well, since government has a way of knowing these things. Yes, you will say that that's a minute proportion. Look, the point has been made. If you use, I think Asiwaju's document makes that point. Just nitpicking, cherry picking for now, before we come and deal with the whole thing properly, maybe tomorrow. Just cherry picking it. If you were to use the BVN number, that would drive a lot of people to go And there are banks that are saying, come and open an account with a zero balance. It means you have a BVN number. Bankers are complaining that we are terribly underbanked in this country. That's just one solution. It doesn't really require a genius. But there are people who are saying, how sincere are we actually in wanting to really achieve that which we profess to want to achieve?
The issue about the BVN and trying to and the palliative issue.
That is using data sources
yes,
already in existence.
We have so many.
Yes.
We have so many.
Somebody said the other day, quite creatively, you can never cheat NEPA.
Yes.
No matter
because there's no
go and build house anywhere.
Yes, there's no
NEPA will reach you.
Exactly, they will reach you. Whether you have meter or you don't have.
Why are we not collating all of this and then you're saying
then we have INEC.
Of course.
Voters card. So with that too, we can also get, and that one is about, we have so many, almost 67 million or thereabout, that we are registered.
Because
if we want to, we have in a lot of database that we can, send.
We need to sort of harmonize
and make
and
it
then
one.
be able to make use of it.
So if you want to use the BVN, for instance, at least close to 31 to 40 million people will get money, depending on the amount. Because I know in America they give about 1,500.
And if you were to announce that indeed,
but it wasn't for everybody.
It wasn't for everybody. It wasn't for everybody. As I said, and well, we know it's not that I said it.
So
people
they shouldn't.
Know that it's not everybody who has a BVN number.
450 million Americans got
no.
No.
No. But you see, the document was making the point that in this kind of a crisis, there might actually be some good that can come out of it. If we were to go the BVN route, for example, a lot of people that for whatever reason keep their money under their mattress, they would go and open up a bank account, even if it's no more an excuse that I don't have money. Banks allow, come and open with a zero balance. They will get the important BVN number, and we're beginning from there. Because you've got to get succor, you've got to get something to people so that they are not helpless. And the document, majored on that human and humane aspect to the whole thing.
Exactly.
It's one thing to be in a war room somewhere and all kinds of eggheads and boffins and they're indispensable actually. They're planners and strategizers. But at the end of the day, people are saying the most plaintive things. I'm hungry. I am hungry. There is nothing coming in. That has to be addressed. It is being addressed. We had a jury. We had a jury, the presidential spokesman, tell us the great strides that are being made by the federal government. But when you look at it, even government itself is not saying that they are unaware of the fact that a lot more needs to be done. So ideas are coming out here.
No. The thing is, there are so many ideas, but execution is always the problem. Now Lagos State is saying they want to feed a brilliant idea. They want to feed 100,000 youths, which is as in giving them raw food. Brilliant idea. When is this going to be executed? We don't know yet, but it's a brilliant idea. Going to local government, maybe giving raw foods to the youth. Is a brilliant one. Then another thing is, I 2 days ago or so, Oshun actually gave cash to the aged and the physically challenged. The people living with disability. They had card. How did they do it?
Now, in fact, let's look at the case of Ekiti. We have a package on Ekiti, which I understand has been ranked the second best prepared, if you want, in terms of preparation for the COVID-19 situation. Let's take that package now.
We had put in our emergency management team together. We had started to have meetings. And so
a prompt and total action by the government has been largely beneficial in curbing the spread of coronavirus in the state. According to the result of the study released by CES Business Organization, Ekiti, which has recorded 2 cases of COVID-19, came second and shares the second position slot with Ebonyi State, which has not recorded any case. The dynamic measure of states' aggressiveness in combating the virus ranks Lagos State, which has highest number of cases in the country, as first on the COVID-19 State Response Index. Ekiti State has just extended its lockdown by another 14 days as all borders remain closed and movement around the state restricted. A move around the state suggests that security operatives have increased the number of roadblocks in the state as vehicles had to make U-turn at some point as tempers fly between security and residents who are on essential duties. Some residents of the state feel that federal and state government palliatives are yet to be felt.
I'm just hearing by just the news. I've never even seen where someone is taken. Not even me. I'm just hearing. And you know, there are a lot of propagandas.
If you, like the federal government said that they are giving 3.6 million people in a population of about 200 million, you see that is not significant. The government is trying, but the government has to do more.
No active case of coronavirus in Ekiti State, but government wants people to stay indoors so as to forestall eventualities.
Ekiti State residents are getting used to the lockdown. As you can see at either side of the road, everywhere is quiet. But the big question that residents are asking from the government is, will there be enough palliatives to go round at this time of lockdown? Ayomide Ajay, TVC News, Ado Ekiti.
Okay then, and well, sorry about that. We need to apologize because we said we'd let you call in. The phones are playing up. It happens from time to time. Sometimes they're good, clear as a bell, and then other times it is what it is. But let's cross over to Ondo, where they also are grappling with the need to restrict movement. The people have been appealed to, but if you're not going to listen to appeals, then we're going to have to get a bit more active, so to speak. Let's go with that report.
2 out of 3 coronavirus cases in Ondo State came from India and Lagos State. And so, it's a serious business for the Interministerial Committee on COVID-19 to ensure strict compliance to the border closure directive. The committee did not allow emotions to becloud its sense of duty to allow any vehicle to enter the state. Members of the team trekked over a kilometer from Igbaraoke, where it began its assignment down to the Owena boundary with Osun State. At this border were security personnel and health officials who were screening those who were allowed into the state.
I'm going to Otanel, from Okene. I live Okene this morning.
Tires were deflated as argument ensued between security personnel of both neighboring states. Members of the committee expressed dissatisfaction with the poor compliance at the borders.
We have advised people to stay home, not to move about at all because of this COVID-19 palaver. But people are not yielding to that directive. That's why we are here to ensure that we enforce the law. Definitely not satisfied because we met people still moving up and down. Even people that are not ordinarily on essential services.
Information reaching us that motor has still been allowed to come in indiscriminately. We have to come and assess the situation on the spot personally. We've seen a lot of things, a lot of vehicles coming in through Osun axis. So we have no option than to start turning them back. We turned nothing less than 40 vehicles back from here now, this afternoon.
The committee also urged security agencies to be alive to their responsibilities by ensuring that people don't move in and out of the state. Ayodeji Moradeyo, TVC News, Igbaraoke.
That's one of the reporters out there. You know, you see, it looks like a war situation, and it has been said that we are in a war.
Yes.
Where people are barricading the roads. No. In fact, I just saw a clip of a sentence, go back to Ibadan. So that direction you were coming from Ibadan, go back to Ibadan.
You know, but from that report, you could see even those who are trying to enforce the law are not also taking the directive of social distancing, and they are not wearing face masks. So, and this thing is not about you not wearing, it's about the droplets. You know, because if you are standing very close to somebody and you are talking, if I have,
what you're talking about reminds me of a story that sort of went viral yesterday. It was in Abuja. It concerned the Federal Road Safety Corps and a young lady who refused to, engage with them, which on one hand could be, illegal, but she was saying that they weren't wearing face masks. And, so I'm not going to let you're compromising me.
Exactly.
Needless to say, the Federal Road Safety Corps has put out a statement that it has withdrawn that team, and they have said that they totally frown at the actions and activities of that particular team. And it goes against everything that, they stand for, and it's like they just stopped short of apologizing. So, but the very tone of it was that that team had been withdrawn and that they were going to be queried and sanctioned. The young lady, and they chased after her.
Yes,
and
they
you saw it. They tore off her license plate.
Yes, yeah.
And the guy was angry. There was a big FRC guy. He was
without
angry,
face mask.
without face mask, and he was bellowing. And he bellowing there, God forbid, there might be some spray. You weren't wearing a face mask, for goodness sake. And it was exactly what the young lady was saying. I don't know. I think I heard somewhere along the line, we are from AIT or whatever. Maybe she was on essential duties, but she refused to deal with them because they weren't adequately kitted. And so it just goes to show that it's not just ordinary people it's not just our people.
Exactly.
Even some
they
organizations,
have to be protected.
Even some organizations need to show an example, show the way, and you can't have FRSC people, not being adequately and properly kitted.
Exactly.
But as I said, the Corps has actually put out a statement there, and I think it's in one of the papers this morning. I think it was in the Vanguard that, totally against all our known procedures. In other words, they were almost like a rogue team.
Exactly.
Almost like a rogue team. That this
it.
is not part of FRC.
Exactly.
This is not how we behave.
So for those who are on essential duty, that is the police officer who are trying to enforce these laws, they must always have the kits, the face mask at least. As simple as the face mask is. Because I can see that so many state governors or state governments, they are trying to mass produce this. Abia State, Lagos is about to mass produce. I think they've even started. And some other states, so Delta states, a couple of some youth corps members started producing, and then the Delta states keyed into that idea, and they are giving it out for free. So other states can do this, because I know the Minister of Health was saying something about face masks. So encouraging people to wear face masks if possible. When once you are in a very, in an area where there's going to be a group of people, there's nothing stopping you from wearing. In fact, it's TVC here. There's no reporter, there's no cameraman that is going out without a face mask and a hand glove. And inside too, we encourage people to wear face masks. Use the sanitizer. Wash your hands regularly.
I think it's just that
because we have a team already that is enforcing these rules.
Do you think we should wear face masks at all? That would be overdoing it a bit.
Yes, so that we don't start looking like masquerades.
But the point, I was just joking. But the point is very well made. It's like you can't over prepare. We just have to do everything to disrupt, break the transmission, this community transmission. That's where it's at now. Before, it used to be people were bringing it in. Well, I'm afraid it has come in. Now the next thing is we got to find a way to protect ourselves from catching it.
I think the next thing people should be thinking is who has it should be the next question. Because sometimes somebody might have it, you don't know.
You don't know because they are what they call asymptomatic.
Asymptomatic. So nobody knows who has it. So the best thing is try and prevent yourself from having it in any way possible.
Okay, we're going to have to leave it there today. And again, once more, we're so sorry about the phones. We're working on it, and tomorrow, fingers crossed, the phones will be okay, and we'll be able to receive valuable input from home as well. So until then, from Asukwa James and myself, Yori Folari, Join us tomorrow for a fresh edition. I am Yori Folani. I always say that. Bye-bye for now.